talking about HIV reduction, we always hear about prevention or about treatment as prevention. Have you ever heard about stigma interventions? Let us be reminded of what Ban Ki-moon had to say about HIV-related stigma. Stigma remains the single most important barrier to public action. It is a main reason why too many people are afraid to see a doctor to determine whether they have the disease or to seek treatment if so. It helps make AIDS the silent killer because people fear the social disgrace of speaking about it or taking easily available precautions. Stigma is a chief reason why the AIDS epidemic continues to devastate societies around the world.
Quem mostrava esse caminho longe, quem mostrava esse caminho longe, esse caminho passou também.
If it is so, we have to do something about it. So if all funds for HIV are allocated to treatment as prevention and some to prevention, why don't we show the relation between stigma and prevention?
Saudade, saudades minha terra, sun and cloud.
But first, we have to distinguish between self-stigma, what a person feels about himself, and social stigma, what a society thinks about a specific group. To reduce the latter, we have to address the first, so people living with HIV would be able to accept themselves. Like Nadine Ferris-France from the Irish Forum for Global Health said in ICASA 2015.
Simple. If I don't think I'm bad, why would I think you think I'm bad? If I don't believe I'm bad, I won't be out there thinking you think I'm bad. I will project my own beliefs about myself that I am good. And even if somehow you find out that indeed you think I'm bad, it doesn't stick so well because I don't believe it about me. And in this way I see that for us to deal with self-stigma, I think it can become the most effective strategy we have ever had to deal with social stigma. So I change, the world changes. It's not possible for the world not to change. It's not possible.
So evidently, the only way to reduce social stigma is to reduce self-stigma. Only when people living with HIV would know the difference between HIV and AIDS will they know they can live with HIV and not the disease. Only then people living with HIV would speak openly about themselves, like Ibrahim El-Habhi from Morocco.
When you say to someone that you are living with HIV, the first picture that you have, it's pain and crying and suffering. But we enjoy life and we live among people like normal. The only thing that bothers us is the pill at midnight.
Only when people be unstigmatized and speak like this, only then will the social stigma in our society decrease.
Quem mostrava esse caminho longe, quem mostrava esse caminho longe, esse caminho passou também.
So what is the relation between prevention and treatment to stigma? A self-stigmatized person living with HIV might A. Adopt a risky behavior, therefore increase HIV incidence. B. Not adhere to antiretroviral treatment, what makes people living with HIV's HIV level undetectable and almost non-contagious, therefore increase HIV incidence. And the person living with HIV who's unaware of his HIV status might C. Not get HIV tested, continuing to spread HIV unconsciously, therefore increase HIV incidence. So what should be done? According to Saima Jiwan from the Global Network for and by people living with HIV and AIDS,
I think the main thing is to focus firstly on self-stigma. Okay, looking at oneself. Why do we have self-stigma? Why do communities face stigma? Okay, working with our stigma index tool in country, taking those results and advocating for policy changes, advocating for treatment, advocating for healthcare workers to be properly trained and not stigmatized.
So, now it's time to advocate for more research and more intervention to reduce HIV-related stigma, because first, Self-stigma is a barrier for antiretroviral adherence. Second, self-stigma is a barrier for prevention. And third, social stigma is a barrier for HIV testing.
Quem mostrava esse caminho longe, quem mostrava esse caminho longe.
Okay, thank you very much.
Thank
It was
you
a
for
pleasure.
having me.
Okay.
Saudade, saudade.